Okay. Hey, Alexandra, come on in.
Hi, I'm Alexandra. Nice to meet you.
Yeah, nice to meet you too. I'm Arpita De Palma. Very nice to meet you. Have a seat, please. Well, I'm definitely glad to have you here. Mr. Bernard said a lot of great things about you. And, tell me why you're interested in coming to Virginia I-Spine.
Well, ever since Mr. Bernard had brought up this opportunity at the beginning of our program, I've been very interested. It would definitely make me a better medical assistant. And after also watching the CBS Morning News about Dr. De Palma and his successful surgeries and all the research that he's doing and how he's the #1 spinal surgeon, I would love to work under someone like that.
Wow, that sounds good. Yes. We work with patients that have had previous back surgeries that, well, they didn't have the best outcomes. And so what Dr. De Palma does is very unique and very intense. How do you think the skills that you've earned in your program would help us in our practice?
So after also talking to Mr. Bernard, sorry.
That's okay.
I have just recently received my EKG certification, and I learned that Dr. De Palma does a lot of research and needs that assessment through the EKGs for his patients. I've also learned about aseptic and surgical hand washing and all of the infection controls, how to keep a sterile field in a surgical unit.
Okay. That's good. That's real good. That's real good.
The pharmacology stuff too.
Yeah, let's do that.
I've also previously had a course on pharmacology, and I feel I'm very strong in that. With patients going under anesthesia, I would need to know how to assess them before, after, and during the procedure, and all the adverse reactions that they may have during that.
Okay. Not transitions, transfers. Yeah, cross-training with the PTAs.
Also, throughout my program, I had learned, we also cross-trained with the PTA students and how to transfer patients from a wheelchair to an exam table and vice versa. And I feel like that will help suit Dr. De Palma when he's doing his procedures.
Good. That's very good. It definitely sounds like the skills you have would be very helpful with us here at Virginia I-Spine. Tell me one of your weaknesses. What do you think is something that might be an area of improvement?
An area of improvement for me would be that I'm sometimes overly confident in what I'm doing, and the teachers sometimes need to reel me back in. But that also could be to an asset of that I am willing to do anything and help out where it's needed.
Very good. Very good. Well, can you tell me about a time that maybe you had a difficult customer to work with, or what if you'd had a difficult patient? How would you handle a situation like that?
I personally haven't run into any issues, but if I were, I would listen to the patients complain about what's going on, and then I would rephrase it back to them to make sure that I heard them correctly, and if I couldn't solve their issue, I would go talk to the practice manager, and once the practice manager had talked to them, I would make sure that they got taken care of in the areas that they needed to be.
Very good, very good. Well, what would you do, since we do have patients that are under anesthesia, and sometimes they may have a problem associated with the anesthesia, what would you do if a patient did have an emergency associated with the medication that they were on?
I would right away go get someone as a practice manager or a nurse to come help me assess them and get it figured out before it's worse.
Okay. Call for help. That's okay. That's okay. Let's call for help. And then I would assess the patient for pulse, which is circulation, and then breathing, which is airway. Okay. Chances are they're not going to fall and split their head open and be bleeding out. Most likely what's going to happen is they're either going to go into respiratory arrest because of the medication. You know what anaphylaxis is, right?
Like an adverse reaction.
Exactly, but a severe one,
right.
A super severe one. You get stung by a bee and 2 seconds later your airway closes up. Or if you ever saw that movie, The Game Plan, that had the rock in it, that little girl ate a cookie that had potato chips, that had peanuts in it, and it took her no time before she was doing one of these numbers, and the rock ran into the ER. So you might even want to mention that. Chances are, if there was an emergency situation, it would be an anaphylactic reaction to one of the medications that was administered to the patient. So I would first call for help and make sure that somebody was aware that there was an emergency going on. Then after I had called for help, I would assess my patient, starting with pulse, and then move on to airway and breathing. Okay, something along those lines. Okay, good. That's not bad. That's not bad. Well, it sounds like you would be a pretty good fit here. Do you have any questions for us?
A question that I have for you is, I know that the patients have a lot of acuity.
Yeah, we're going to have to work on that.
Acuity?
Due to the acuity of the patients.
Due to the acuity of the patients in your clinic, that requires a lot of follow-up. Do you guys incorporate telemedicine into your practice?
Okay, good. At this time, we don't incorporate telemedicine. Okay. Hopefully they give a better answer. You're going to have to own that question. It's such a good question. You're going to have to own it. Okay. But the acuity is nice because that they're going to know what you mean by acuity. That's going to show higher level thinking when you mention acuity.
And that means like severe.
It's intense. Yes. Acute, is something that happens like that. Well, in the hospital setting, when they're talking about patient acuity, what they're talking about is your person that has the sniffles because they have a cold versus your patient that is, has a tension pneumothorax and they're about to suffocate internally. Low acuity, super high acuity. Not going to die for 100 years, going to die in 100 seconds. Okay, so that's what we're talking about here with acuity.
Okay.
So again, let's go over that. Let's see if we can get that. So do you have any questions for me?
So I know you have a lot of patients who have acuity.
Due to the acuity
of the patient.
Right. Due to the acuity of the patients Dr. DePalma sees, and I know they need a lot of follow-up, do you all have telemedicine here to help with following up with the patients? Something along those lines. Again, we're going to have to make it so where you own it. And if we don't use acuity right, it's going to sound like it's scripted. So we just have to be careful. But like I said, I think it's worth trying to work it in because it's going to sound really impressive. Okay, let's go for it. So do you have any questions for me?
So due to the acuity of the patients that Dr. DePalma sees throughout the day, do you guys or with the follow-up that the patients will need afterwards, do you guys incorporate telemedicine into that?
Good. That's what we need. We need to make it your own, rough out some of those edges, but the bones are there. We just need to flesh them out. Nice. Blah, blah, blah. We don't do telemedicine, but we're looking into it. Blah. Okay. Well, do you have any other questions for us?
I just have another question. So I like to work in a team-oriented environment. I was wondering if Virginia iSpine, if all their clinicians work together to best suit the patients.
Don't say it like that. Remember.
To make sure the patient has a favorable outcome.
Okay, true. We want to put that in the end. But remember, can you give me an example? That will really sound good. Okay?
Sorry,
That's okay. No. That's why we're here.
Okay. So I like to work in a team-oriented environment. Can you give me an example of how all the clinicians at Virginia iSpine incorporate that to have a favorable outcome for the patients?
Good. Let's say it one more time because that's almost perfect. Do you have any more questions for me?
I just have one more question. So I like to work in a team-oriented environment. And can you give me an example of how all the clinicians at Virginia iSpine incorporate this to have a favorable outcome for the patients?
Good. Very good. Blah, 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 blah. Okay, good.